Hello, I'm Joseph Albert, editor-in-chief of the American Journal of Medicine, and I'm here to call your attention to what I think is a very interesting article in this month's AJM. It's from Shootman et al. From Arkansas, and what they did was they evaluated the effect of where you live on your chance for developing disease. So, for example, if you lived in a very high-end, expensive neighborhood with good access to food and medical care and so forth, that was compared to if you lived in a rundown neighborhood where perhaps the access to good food and medical care was less available, and maybe there was more violence on the street and the housing was not as safe and so forth. And they compared the two. And to no surprise to me, the lower neighborhood you lived in, the less adequate the neighborhood was in terms of all of the things we just mentioned, the more likely you are to be sick, particularly with hypertension and diabetes, and not do well. So, and this has been pointed out before. A big article in JAMA about 5 or 6 years ago said how long you live depends upon your zip code. And I always tell my European friends, the United States is two countries, a first world and a third world country. You live in the third world country, you have a lot of health problems and you do not do well. Thanks very much for staying in touch with the American Journal of Medicine. I look forward to talking with you next month.